Um, for
For
someone new
someone
to
new to
CHC,
CHC,
what does
what does
the two
the two
schools
schools
plus
plus
clinic plus
clinic plus
community
community
education
education
plus
plus
resource
right?
library, how does that model look like in practice?
Yeah, I was going to say, because we do a lot of different things. But what I think it is what we've really set out to do is build a system of care. And so I would say there's two fundamental things we do. We both serve young people directly and we work to empower the systems that they interact with. And so what that looks like is whether it's in our schools or our clinics, we're doing direct work with kids that have learning differences or mental health needs. And we're trying to give them just high quality care and support to help them grow in their skill set and be more successful. Beyond that, we're also working with parents. We're working with school districts. We're working with our local community and helping equip them with the skills of how do you interact in a more effective way to help young people that maybe aren't having the success that most other kids are having, be it through their learning differences or their mental health needs or a whole variety of factors that could be happening in their lives. And our thought around this is thinking in, if we're going to have direct impact on kids, if we also strengthen the systems that are surrounding them, we're sort of uplifting the whole community. And so our intentionality has really been, how do we build this system of support or this ecosystem that's meaningful to really contributing to our community, giving back. And so, like, I'll give you an example of a project that we're running right now. Is we've developed something that we call Ellis, which is an AI powered resource. And it's built on, we do a lot of consultation and coaching to our local school districts. That's usually based on them reaching out to us and saying, hey, we have a question. We're struggling with this young person or this collection of young people, and we'll give them consultation. We also realize there's a limit to our ability to do that on a larger scale. And we had this amazing resource library that you mentioned, and we have a bank of professionals, and that this with AI gave us the opportunity to actually deliver direct feedback to teachers in a much more immediate way so that they can interact in the way that they're comfortable with and asking questions to get guidance on their instructional practice that's evidence-based, comes from trusted resources, and it takes it and it helps them build out longer term plans for working with those young people. And so again, we can directly go in and support that school district. We could offer them a tool where the teachers can kind of take it with them and get continual feedback and reinforcement. And at the same time, we're still running our full schools, our clinics, and working directly with young people as well.
Right. So now with Ellis, you can support more schools. You can scale the support to even remotely, right?
Yeah, that's right. Essentially, Ellis has no boundaries. It's something that all teachers can access. I mean, right now we're sort of in our pilot phases and we're rolling it out more locally based. We're using some of the school districts that we already partner with. So maybe a school district has a couple students in one of our schools and they have access to this resource right now. But it takes what we've done for a long time in helping school districts be the best version of themselves, and it gives us a tool that's able to deliver our expertise on a much wider scale. I mean, what we often tell people is it's like putting our expertise in every teacher's hands. And it's a way for a teacher to have, a way to get their questions answered from a trusted source in day that they might not otherwise have, that they might, have to, wait in line to see one of their administrators or hope they could do a consult with us or have to go out and search on their own and sort of vet through, is this a good, reliable resource or not? Now we can deliver something directly to them, and they could tailor it along the way. So you could build out a action plan, and 2 weeks from now, based on progress, you can go in and say, this is what I'm seeing, this is what I've done, this is what's worked, and it will tailor it and redefine sort of feedback for that person. It's a new project for us, but it fits in that lens of how do we uplift systems and how do we get our expertise more readily available to the community so that just more practitioners are feeling confident and working in, I would call, ever increasing complexities within our larger school systems.